Hey, this is Rick Kaselj from exercisesforinjuries.com. I got an excellent question when it comes to looking at how the shoulder ends up relating to elbow pain, and if there's anything that I end up looking at in the shoulder when it relates to elbow pain. So if we look at the elbow is very much like the knee. It ends up being at mercy to the shoulder. If you look at the knee ends up being at mercy to the hip. So a lot of times when there's hip issues, hip weakness, hip tightness, hip injury, a lot of times all of that ends up having a negative effect on the knee. And the same thing ends up happening in the elbow when there is weakness, poor activation, tightness, poor movement patterns. That all ends up affecting the elbow, putting greater strain on the elbow, leading to pain, leading to injury, slowing down recovery from injury. Now, three things that I look at in the shoulder that end up having a good, have a big impact on the elbow are, I end up looking at the scapular stabilizers, so how those shoulder blade muscles are working. The second thing I end up looking at is pushing, and then the third thing I end up looking at ends up being the pulling movements. So when it comes to the scapular stabilizers, I want to end up looking and seeing how those shoulder blades are when people are exercising or working out. Do those shoulder blades stay flat up against the thoracic spine, up against that mid back, or do they end up winging? So the scapula, the middle border of the scapula ends up lifting, or even the bottom part of the scapula ends up tilting up. So I want to see if that ends up happening. If that ends up happening, let's say with pushing movements or pressing movements overhead or diagonal pattern movements, it's my cue that I need to end up working on them. And I need to look at working on the activation, endurance, and strength of those scapular muscles. And I end up usually utilizing what I end up covering in the scapular stabilization exercise program. So that ends up being part one. And then looking at the second thing I end up looking at is how are they when it relates to rowing movements. Now when looking at the rowing movement should end up coming from the shoulders. That's where the rowing movement should end up happening. If they end up having a poor position in the shoulders, then the wrists and the elbows end up playing more of a role when it comes to the rowing. If they end up having a good posture, if they end up having that rowing movement coming from the shoulders and then the elbows and the wrists assisting, that's what I want to end up looking at. If I see collapsing in the shoulder, if I see the wrists and elbows being the primary things working, and then the back, that's something that I need to end up working on. Either there's a weakness or there's motor pattern that I need to kind of re-educate when it comes to things. Now the exception will end up being when you're ending up being at those really heavy loads, then you'll get more help from the accessory muscles. But I want to see if they're at those lower loads that we end up having the good position of the shoulders starting things up, and then the elbows and the wrist helping out or being accessories to the movement. The third thing I'm going to end up looking at is I want to look to see how we are when it relates to the like the pushing movements. And I can end up looking at the push-up, and the push-up will highlight things when it comes to the scapular muscles like I talked about, and then it'll end up also helping to see if there's excess stress and strain on the elbows. So I can just end up getting them to do a push-up movement, and what'll end up happening is, if the elbows gravitate out more, there'll end up being more stress on that elbow. If the elbows end up being closer, there'll be less stress on the elbow. And if they end up activating and bringing in latissimus dorsi in the pushing movement, or like a push-up movement, they'll end up being less stress on the elbow. And a little self-test that I'll end up getting clients to do is I'll end up getting them to relax the abdominal area, stay weak in the shoulders, and go through just like a wall push-up or a push-up movement, and ask, how does that end up feeling in the elbows? Does it feel like there's stress and strain on the elbows? And then I'll end up asking them to build tension in those lats, bring the elbows down, or as Dan John had said, bring the elbows back like you're crushing the heads of little monsters. I believe that's what he ended up calling it. So bring the elbows back like you're crushing little monsters with your elbows, and then going into that push-up movement. Now, asking the client, does that end up taking the stress away from your elbow and putting have more emphasis on the back? And the answer that I'm looking at is yeah. It feels like their back is doing more of the work and there's less stress on the elbow. So you need to kind of do that tweak or that retraining when it comes to the pressing movements. So there you go. If you end up having a client with elbow pain, or if you end up having elbow pain, take a look at those three things. Take a look at the scapular muscles. If the shoulder blades are staying nice and flat during pushing movements and diagonal movements. Take a look and end up seeing how you are when it comes to the rowing movements, so you or your client, and then take a look and see how you are when it comes to the pressing movements. So there you go. This is Rick Kaselj from exercisesforinjuries.com, and if you make sure you swing by exercisesforinjuries.com, type in your injury in the search box. There's a good chance that I have an article or video on your injury or pain. The second thing, if you're watching this on YouTube, head up above and hit subscribe. And what that'll end up doing is you'll end up getting videos like this every couple days. Lastly, if you found this video to be of benefit, hit the like button, which is down below, and leave me a comment down on the blog or down on this YouTube channel. So thank you very much for watching this video. And if you are suffering from elbow pain, take a look at the program that I end up using. And it's called fixingelbowpain.com. So that's it. This is Rick Kaselj from exercisesforinjuries.com saying take care and bye-bye.